So some experts have come out and faulted government's vaccine rollout and that plan, saying that, in fact, ignoring the World Health Organization's directive on the usage of the AstraZeneca vaccine was a mistake. Government opted to sell the 1 million AstraZeneca doses that it had procured and looked to Pfizer instead, leaving South Africa far gone in meeting its targets. So this morning we ask, has the government employed a clear enough vaccine rollout plan and strategy for perspective and a map of a way forward? Let's bring in Professor Susan Goldstein, Associate Professor at the South African Medical Research Council Center for Health Economics and Decision Science. It's at Wits University. Prof, thanks very much for your time. It's great to chat to you. So there are various aspects. I want to hone in perhaps on what arguably was part of the big stories this week. South Africa also admitting, the government, that it's unlikely to meet its own targets to have 67% of the population inoculated by the end of the year. There are many factors to this. How worried should we be?
I think we should be very worried. I'm very concerned about the lack of transparency around what this actual rollout plan is. I think there are two things that worry me a lot. The first is just that the arrogance around the not accepting the AstraZeneca when the WHO said it was fine. And actually, if you look at the information around it, the AstraZeneca was the test that was so poorly, that showed poor results, was about infectiousness. It wasn't about protecting from disease and death, severe disease and death. And that, for me, is the key. That's what we're trying to look at because we want to open the economy. I mean, it doesn't matter if people get cold-like illnesses, but if we can save the hospitals and decrease deaths, that's the main thing. And unfortunately, that isn't how it was interpreted by the MAC. And the advice that the WHO gave and the SAGE, which is the Special Advisory Group on Immunizations, I mean, these are world experts. They've looked at immunization many, many times. It's just terribly frustrating. And also the other problem is the advisories that the MAC are supposed to be sharing with everybody. The last one that was shared was the 3rd of February.
Sure. Let's unpack that categorically and systematically. If the poor results from the AstraZeneca vaccine pointed to issues around infectiousness, what could that potentially mean for a country like South Africa, where A, we're dealing with a highly infectious variant, and B, the ability to pass on the virus could lead to even more mutations?
Well, it's difficult to say. I mean, it is true that that might happen, but if we manage to get everybody vaccinated, then of course this wouldn't be a problem because you might get infected, but you wouldn't get that ill or very ill. The variations seem to be when somebody is infected for a long period of time. So it seems that it enables it to change. I'm not a virologist, so I wouldn't take my word for this particular part. But I do think that the main thing, really, in order to open up the economy, is to make sure that people don't get very sick and die. And I immediately that the government said that they are going to sell the AstraZeneca, I was appalled.
Part of the concerns that were being raised at that time was around this expiry date of the AstraZeneca vaccines. If government were to come out to say that actually part of the reason why we had decided to sell it was because there was no way we'd be able to administer all the doses before the beginning of April, would that be enough of a reason then to sell these vaccines to other countries?
Well, there are two parts to that. The first part is that the reason why they said it has expired by April was that they haven't had enough time to see how long it can last. So they said it might last longer, but they didn't know. I think the second point is, you know, instead of admitting defeat before you even try, what about bringing in the private sector? What about bringing in pharmacies? You know, I mean, the fact is that it could have been possible.
We also heard reports from News 24 that, you know, there's a real possibility that government may have fumbled that 1.5 billion rand deal with Pfizer, which was expected to bring in vaccines into the country sometime next month. And part of the reports is mentioning that this is because government had failed to meet a key contractual clause to ensure that this happens. Is that something, from what you know, that could happen? And if so, how far-reaching could be the implications?
Well, I certainly hope it's not true, but it sounds like it may be, and certainly the whole handling of this is really being, in my view, quite unsystematic and unclear. And I feel that although we kind of the Prof. Gray stepped in with her study, we actually have not started rolling out a vaccination program. And that to me is really shocking. And especially for frontline health workers, like people in primary healthcare clinics, are still facing the same problems that we had last year.
A lot of what government has had to say in its defense is that there are also supply constraints. Because we simply don't have the money, we couldn't have ordered in advance, and that's pushed that to the end of the queue. Let's entertain that as being true and as being legitimate. If we do that, what is the best way to go about fixing the problem now?
It's a very difficult one. I know we don't have money, and we need money for all sorts of things, social grants, basic income grant, etc. However, I mean, if we want to get the economy going, we really need to get rid of this stuff. And I don't know. I feel like other countries seem to be managing. And there was the delay in paying off the COVAX facility, and we weren't, whether we were in or we were out. And certainly other countries have got started their programs with COVAX. So it's, I'm not sure. I don't know the ins and outs of these deals. I'm sure that they're complicated and difficult, but I do think they should be getting very high priority.
Of course, and I think to be fair, we certainly get indications that government is spending a lot of time thinking about these things. Perhaps that's not enough. In the interim, ordinary South Africans continuing with the non-pharmaceutical interventions. I can't imagine being able to do anything else outside of that as we wait for these vaccines.
I think so, and the very big worry, of course, is the upcoming Easter weekend, where everybody is traveling, going to big ceremonies. I mean, even the burial of King Zwelithini was a concern. It could be a super spreader event.
Yeah.
We were still in the middle of this terrible epidemic, and people are still dying, despite the fact that we are not in a high level of concern at the moment. But the chances of going into one, again, are very high.
Yeah. The ambition of trying to inoculate 67% of the South African population by the end of 2020 has always been criticized as being overly ambitious. There have been revised plans. In fact, we're being told that Phase 3 should be finalized by February next year. Does that sound a bit more doable to you?
Our ordinary, essential immunization program for children is very poor in some areas. So although we've got an 80% coverage of children in the country, in some places it's below 60, below 50. So given that, I very much doubt that we would ever get to 60% in an immunization program where we're immunizing people that we've never really done before. So we've never done adults before, except for flu, where we've had very limited stocks. So I think even February to me sounds quite ambitious, but that's great. We need to be ambitious.
All right. That's an interesting balance. We've also heard reports further afield from India, the Serum Institute of India, in fact, which gave us the 1 million AstraZeneca vaccine doses, saying that they're no longer going to be exporting the doses because of the pandemic in India itself. They want to focus on the domestic trends before assisting further afield. It sounds like what anybody would do, but it's also happening in the backdrop of what the World Health Organization is describing as a grotesque inequality in vaccine distributions across the world. Are you at all concerned about that? This apparently nationalistic leaning that the Serum Institute is taking?
Yeah, absolutely. It's not only the Serum Institute. I mean, it is, as the WHO describes, it's across the world. So this nationalism, we will immunize everybody in our country, plus, and to hell with the rest of the world. And without recognizing that actually nobody is safe till everyone is safe. But having said that, it's not surprising because if you think about other vaccines like pneumococcus, for example, how many children in Africa can get the pneumococcal vaccine?
Yeah.
I think South Africa may be one of the very few countries that is able to vaccinate our children against it. So it's not something that's new, this huge inequality across countries. But it is shocking, I suppose, within the context of a pandemic.
Absolutely. And as that happens, government this week has also been at pains to try and assure South Africans that there is capacity and enough competence to see this through. Very quickly, do you believe them?
I think there is, but there are huge stumbling blocks.
Yeah.
And I think that places like the health service place, like in the Eastern Cape, for example, it's a huge problem. And there are lots of places where the health service is not functioning properly. So we may be able to see it through. Let's just hope that they're correct. I do think that these public-private partnerships are very important for that.
Absolutely. Professor Susan Goldstein, thanks very much for your time here on Newsfeed AM. Professor Golding is the Associate Professor at the South African Medical Research Council's Center for Health Economics and Decision Science, and that's at Wits University. Prof, thanks very much indeed.